You're committed to exercise, you might be wondering what is the best time of day to exercise. I'm going to go over some research that may help you make that decision. So, first of all, just remember that this is not medical advice. This is just educational and entertainment. I'm a doctor, but I'm not your doctor. So, this is a study I'm going to review with you here. This is from a journal called Diabetes Care, and it's about the timing of moderate to vigorous physical activity and the correlations between when people exercise and certain outcomes regarding their health. Okay, so what was the study about? Well, what they were looking to do is examine how the timing of exercise correlates with health outcomes, including cardiovascular disease, microvascular disease, meaning disease in the small vessels of the body, which can be really important for things like stroke and other types of functioning, as well as mortality, somebody's risks of actually dying. And they looked at people who were obese, including people with type 2 diabetes. So, looking more closely at the populations that were studied, we see that this was a study done in the United Kingdom, England, and they looked at people who had obesity. They had about 30,000 people in the total sample, and approximately 3,000 of those had type 2 diabetes. Now, in terms of the exposure, and what exposure means in health studies is often the variable that they're trying to sort people by. So here, people were categorized into whether they had morning, afternoon, or evening exercise that was moderate to vigorous in its intensity. And they only included exercise that was at least 3 minutes in duration. And compare that to people who had no exercise or no moderate to vigorous physical activity, which they call MVPA. Now, what were the health outcomes that they were looking to study? As I mentioned before, they're looking at who's actually dying, all cause mortality, and the amount of cardiovascular disease, which they abbreviate as CVD, and microvascular disease. And that includes things like retinopathy, which means a disease state of the retina in the eye, neuropathy, which affects the nerves, and nephropathy, which affects the kidney. The analysis was for about 8 years and included about 1,400 people who died and thousands of disease events. So, a lot of data here. And what did they find? This graph is very informative. So here we see everyone's chance of dying. And on the left, you see people who have no aerobic activity. That's the reference group. People who exercise in the morning, people who exercise in the afternoon and in the evening. And then on the right, you see what's called a hazard ratio. And a hazard ratio just means what's the chance of something happening. And for morning exercisers, you see 0.67 as a hazard ratio, which means that there was approximately a 33% less chance of dying if you were exercising in the morning. For the afternoon, it was about 40% less chance of dying. And then in the evening, it was the greatest reduction, which was approximately 61% less chance of dying with a hazard ratio of 0.39. So that's pretty impressive. Now let's look at a little more detail. Another outcome that was looked at was cardiovascular disease and microvascular disease. So if we just look at the second two lines here, we also see that for evening exercise, cardiovascular disease was reduced the most. A 0.64 hazard ratio is approximately 36% less chance of having cardiovascular disease. And the same is true for microvascular disease. So if you compare it to exercising in the morning or the afternoon, you have improvements in all three, but the greatest improvements with the evening exercise. However, the study does have limitations, as all studies do. And here we have to remember this was an observational study. So what that means is that it was not a randomized controlled trial. They did not take people with all these conditions and then say, hey, you people exercise in the morning, you exercise in the evening, and you exercise in the middle of the day. What they did was they just looked at a snapshot of people. So in those kind of studies, there's a lot of confounding variables, which means that there's other things that could have influenced the outcomes. Specifically, people who exercise in the evening just could be different than people who exercise in the morning. Why might that be? People who exercise in the evening probably have jobs, and people who exercise in the middle of the day or the morning maybe don't work. So maybe there's something different about people who have full-time jobs versus other people who don't, and that explains the differences in the groups. It's not the timing of exercise per se. That's something really to keep in mind. Other thing is that there were some time lags between the initial data collection and the physical activity measurement, which could account for differences. But I think the biggest issue is the confounding in an observational study. So take this result with a grain of salt. Okay. And so what I would take from this is that you might want to look into exercising in the evening and seeing if it makes a difference in your life, as it did especially seem to make a difference in terms of correlations for these types of metabolic conditions like cardiovascular disease, risk of dying, and microvascular disease. However, there's a lot of confounding going on here. So it's just one study, but it is very interesting. So if you have found this helpful, please consider liking it if you want me to make more stuff like this, or subscribing if you want to hear about other videos like this. And for some products that I find helpful relating to this topic, please check out the video description below. Thank you so much. Take care.